Most seniors believe that doing more checkups means staying safer. But the truth is, some tests can actually create more problems than they solve. Every year, millions of older adults get screenings they don't really need. And research now shows that up to 37% of these tests lead to unnecessary treatments, side effects, fear, or even procedures that were never needed in the first place. And the surprising part? Almost 99% of people over 70 have no idea they are being overtested. In this video, I'm going to show you 5 medical checkups you should think twice about after age 70, and explain what the safer options are. My goal is simple: to help you stay healthy, informed, and in control of your body, without going through tests that may harm more than help. Before we begin, tell us in the comments. Where are you watching from? How old are you? Have you ever had a test you later regretted? We're reading and responding to every comment. Now, let's start with number 5. Number 5, Bone Density Scan, DEXA Scan. Bone density scans sound harmless, and they usually are. It's a quick scan that checks if your bones are thinning. But here's what many seniors don't know. After age 70, bone density naturally gets lower. This is normal. Just like wrinkles or gray hair, it happens to everyone. Because of this, the scan often shows osteopenia, a mild drop in bone density. But this result can sometimes lead doctors to prescribe strong medications like bisphosphonates. These medicines are powerful, and they can help certain people. But they also come with risks. Stomach irritation, serious reflux, inflammation in the esophagus, very rare cases of jawbone damage. And here is the important part. Studies show that treating mild bone loss in adults over 70 makes very little difference in preventing fractures. Let me tell you about Rose, a 76-year-old piano teacher. She had no pain, no falls, and walked every day. After a routine scan, she was told she had osteopenia and was put on medication. Within weeks, she developed severe stomach issues and jaw pain. When she came to us, we stopped the medication and focused instead on gentle strength exercises, vitamin D, calcium-rich foods, balanced training. 1 year later, she felt stronger, healthier, and had no fractures. What works better than the scan after 70? Weight-bearing exercises, resistance bands, walking, vitamin D, better balance. These reduce fracture risk far more than medication for mild bone loss. Number 4, brain MRI for memory problems. When someone over 70 starts forgetting names or misplacing keys, it's natural to worry. Many doctors respond by ordering a brain MRI. But here's the truth most people don't hear. Brain MRIs in older adults almost always show age-related changes. This means small white spots or slight shrinkage, which are completely normal. Unfortunately, once these spots are seen, they often create unnecessary fear. People start to believe something is seriously wrong, even when it's not. In a large study of adults aged 70 to 85, 86% of MRIs showed abnormalities. But only 3% were treatable problems. Yet 12% of those patients ended up getting invasive tests like spinal taps. Let me share George's story. He was 74 and worried about forgetting a few names. His MRI showed white matter spots. He got scared, stopped driving, and avoided activities he loved. When we tested his memory with a basic paper test, his score was completely normal. His memory was simply showing age, nothing dangerous. We focused on sleep, water intake, and daily brain exercises. Within months, he felt confident again. So when is an MRI truly needed? Only if you have sudden behavior changes, seizures, rapid memory loss, trouble walking, numbness or weakness. For mild forgetfulness, a simple in-office memory test is safer, cheaper, and usually more helpful. Number 3. Cardiac stress test. A stress test checks your heart while you walk on a treadmill or take medication that makes your heart work harder. It can be helpful for people with clear heart symptoms. But after 70, stress tests often give unclear or misleading results. Why? Because older hearts naturally have small changes that can look abnormal on the test, even if the heart is healthy. In seniors, the false positive rate can be as high as 40%. That means 4 out of 10 people may be told there's a problem when there isn't. And what happens next? More testing, often an angiogram or even stent placement. Many of these procedures do not improve life or reduce the risk of a heart attack in people without real symptoms. But they do increase the risk of bleeding, kidney problems, infection, long hospital stays. This happened to Raymond, a 75-year-old who walked every day. He felt tired on hills, which is normal for many seniors. A stress test led to a catheterization, which led to a stent, which led to kidney issues and a week in the hospital. And his original tiredness? It was due to dehydration. So, when is a stress test useful? If you have chest pain during activity, unexplained shortness of breath, fainting, serious changes in exercise tolerance. Otherwise, safer options include a resting EKG, a coronary calcium scan. Number 1. Full-body CT scans. This is the most overused and most potentially harmful test for seniors. Full-body CT scans are often marketed as early cancer detection. But the truth is, they expose you to high levels of radiation and rarely find anything helpful. A single full-body scan delivers the radiation of 500 chest X-rays. New research suggests that CT scans may now cause up to 5% of all cancers in the United States. That means a test meant to protect you can actually increase your cancer risk. These scans also often find harmless spots or nodules that lead to more scans, biopsies, surgeries, unnecessary fear. Marcus, an active 80-year-old, took part in a senior VIP checkup that included a full-body CT. They found a tiny lung nodule, completely harmless. But he was sent for a biopsy, and one lung partially collapsed during the procedure. He spent 2 months recovering, all for something that didn't need treatment. Experts are clear. Full-body CT scans should not be done for routine screening in people without symptoms. If you feel well, simple targeted tests are much safer. Closing message. So there you have it, the 5 tests that may seem helpful but can actually cause harm after age 70. Modern medicine is powerful. But the wisest doctors know this. Not every test leads to better health. Sometimes, less is more. Before agreeing to any test, always ask, what happens next if something shows up? And remember, the best prevention is still simple. Stay active. Eat well. Sleep deeply. Manage stress. And choose your checkups wisely. Now I want to hear from you. Have you or someone you know ever been harmed by an unnecessary test? Share your experience below. Your story may help someone else avoid the same mistake. Thank you for watching, and take good care of yourself.